Hi, my name is Beth Wright, and I'm providing you this podcast regarding the inflammatory response. And this is part of the NSG 211 course, Module 8. So, looking at the concept definition, it is an immunologic defense against tissue injury, infection, or allergy. And, we've discussed inflammation many times. I know you've heard it several times throughout the curriculum. And now we're going to have a better opportunity to understand what exactly is going on when we have that inflammatory response happening. Now, the inflammatory response is a process that delivers fluid, blood products, nutrients to the injured tissue, and it also has the ability to promote healing. And so throughout that whole process, lots of things are going on. A common myth with inflammation is that all inflammation is infection. And we need to clear this myth up right now because that's not the case. Now, if we reverse that, all infection is inflammation. That is true. But inflammation can be caused by many things. It can be caused by bacteria, viruses, chemicals, environmental issues such as cigarette smoking or pollution. So lots of different things can cause inflammation. Infection is just one part of that. I wanted to add this slide for you because I think it's important that we hone in on that NCLEX test plan that you'll be taking before too long. And I went to the test plan and just did a search for inflammation or the inflammatory response, and here's what I came up with. It came into the physiological adaptation part, and knowing the patho and the psychomotor skills when we're caring for someone with alteration in a body system, and the inflammatory response would certainly come into play there. It also came into the pathophys part, where we're relating to acute and chronic conditions, and that's what this unit is talking about, is acute and chronic inflammation diseases, as well as understanding general principles of injury and repair, the immunity, and cellular structure. So I just wanted to bring that out, that is a part of your NCLEX test plan. I thought it's important, too, to just begin with first thinking about how our body, being a magnificent and incredible, complex being, how we maintain homeostasis. You know, it's just incredible to think about everything that's taken place in there to help us maintain and be in that homeostasis status. So it's kind of like steady Eddie, you know, everything's in check, keeping us upright and going. Then we have something that interferes or disrupts that homeostasis, and the body goes into the compensatory state. And at that level, we have both a physiological level and we have a local level that we need to think about. So at a physiological level, we have that general adaptation system that kicks in. You've heard of it before, you know, the fight and flight. That involves our sympathetic and parasympathetic nervous system. It also involves the endocrine system with lots of hormones come into play to help in that situation. So the good old fight and flight, and we can refer to the general adaptation syndrome as the gas syndrome. At a local level, we have the inflammatory response that kicks in, and that is a compensatory factor that happens when we have that injury to tissues and cells, and that immune system kicks in and comes to play and comes to help and comes to rescue. And it will generally take care of any kind of local issue, but if it doesn't, and it happens to be too much for that level to handle, then the general adaptation syndrome kicks in, or the gas is poured on, if you will, in order to help us get out of whatever state we're in. So I think it's, important just to consider that and what happens. So inflammation is basically an innate automatic response to cell injury. And when we think of that word or hear that word innate, we need to think about what's within us. Well, what are we born with? What's natural? And it neutralizes any kind of harmful agents. It removes the damage, and dead tissue, generates new tissue, and of course promotes the healing. I feel like it's important that you listen, or refamiliarize yourself, I guess is the best way to put this, to different terms that you might read or come upon when you're studying the inflammatory process. And so starting off with the endothelial cells, those are cells that line the cavities of a lot of different parts of the body, such as the heart, the blood vessels, lymph vessels, any serous cavity of the body. And those cells support and protect, they absorb and excrete and secrete. And then we have our mast cells, and these are cells that are filled with basal cells, or basophils, which is part of your white blood cells. And it's found in connective tissues, and they are responsible for releasing histamine, which I put directly underneath there, so you could tie those two together. And they come into play definitely in the inflammatory response, as well as allergic reactions that we have. The histamine is something that is secreted in response to injury and in allergic reactions, and it causes contractions of smooth muscles and dilation of capillaries. The phagocytes are cells that help protect the body by ingesting the harmful foreign particles and bacteria and dead cells, that kind of thing. It reminds me, the phagocytes, when I see that word, I think about Pac-Man. That used to be a game that you could play. Macrophages are large phagocytic cells that are found in tissue and as a mobile white blood cell that especially comes to rescue when we have infection going on. Thromboplastin, so you see the thrombo there, you should think clot. That's an enzyme that's released from damaged cells, especially platelets, and it converts prothrombin to thrombin during those early stages of blood coagulation. Fibroblasts are cells in the connective tissue that help produce collagen and other fibers. Arachidonic acid is a type of unsaturated fatty acids that is found in most of the body's cells. And when there's irritation or injury, this acid is released, and it helps to produce a lot of the inflammatory mediators. Now, the mediators are types of cells that help mediate, help pull together needed parties, if you will, to solve an issue. And so we have lots of inflammatory mediators. One of those being, which I have underneath there, is prostaglandins. And, prostaglandins are a group of fatty acids or lipids that's made at the site of tissue damage and infection, and they're involved in dealing with the injury and illness. Prostaglandins constrict or dilate arteries. They stimulate nerve endings, and that causes pain. It promotes or inhibits clotting. And so when you think about this, where this comes into play, a lot of times for inflammation, we give aspirin, as you know, to help with the pain and help with fever, and non-steroidal anti-inflammatory medicine. And that's what aspirin does, is it blocks the production of prostaglandins. So that's how that works. Interleukins, those are our cytokines. I like to call them cytokines, but really it's cytokines. And these are a part of that immune process that comes to play when we're having issues in the body as some kind of inflammatory response. Tumor necrosis factor is a multifunctional cytokine that plays an important role in different cellular events such as cellular survival, proliferation, differentiation, and death. And it is a pro-inflammatory cytokine, and it's secreted by inflammatory cells that's involved in that whole inflammatory process. Now, the rest of those terms are the white blood cells. You have your granulocytes and you got your agranulocytes. And with your granulocytes, we have the neutrophils, eosinophils, and basophils. And with your agranulocytes, we got our T lymphocytes, B lymphocytes, and our monocytes. So this is just a nice picture showing some of the cells that we just talked about. The endothelial cells, the basophils, and the eosinophils, lymphocytes, monocytes, and the neutrophils. And so those are all of your white blood cells there, plus your platelets are there. You see the mast cell. So all of these things are coming to the rescue in that inflammatory response. So let's talk a second about acute and chronic inflammation. And so with acute inflammation, it's triggered by some kind of noxious stimuli, such as infection or injury, and it's usually rapid in the onset and is relatively short in its duration, lasting a few minutes to several days. And it's characterized by exudate or drainage of fluid and plasma protein, as well as an immigration of the leukocytes to that specific area. With chronic inflammation, it lasts longer with the duration, and it can last days to years, usually associated with the proliferation of blood vessels, which is referred to as angiogenesis, tissue necrosis, and fibrosis. Which fibrosis, when you hear that word, you should think scarring. So here, basically the inflammatory response just will not cut off. Now, acute and chronic inflammation can occur at the same time. We can have someone with a chronic condition and they have like an exacerbation of that condition that is an acute episode of that. And so you can basically see that happening at the same time. So when we think about the process, so we've got that injury that occurs, then we have a release of lots of different things, chemicals, the kinins, histamines, prostaglandins, all kinds of different things. The mediators occur. We have vasodilators that increase the blood supply to the damaged cells, and then we have that natural defense movement of the leukocytes into the area with the macrophages and the neutrophils that get into that area wherever the inflammation is occurring and taking care of business. When we think about on a vascular level what's happening with acute inflammation is this involves the arterioles, the capillaries, and the venules. And immediately after the injury, initially you have a vasoconstriction that happens just a brief amount of time, but then vasodilation occurs and you got lots of things coming to the rescue with that vasodilation. And of course you have vascular permeability so that the cells can get to the injured site. And there's a leakage of protein-rich fluid into the tissue space there. So dilation begins with the arterioles and opens the capillary beds in that area. And as a result, all of that becomes congested, which causes the redness, which is also termed as erythema. And it also causes warmth that's associated with acute inflammation. Vasodilation is induced by some of those mediators that we talked about earlier, and one of those being histamine. And then we have that increased permeability with the outpouring of the protein fluid exudate into that extravascular space. Now, all of that ends up being swelling, pain, and impaired function as a result of that. Now, at the cellular stage, we have the white blood cells coming to the rescue. They are the main things, the leukocytes and neutrophils as a part of that. They're the ones that are coming to take care of and be the fighters in the inflammatory response. They adhere, and they also do like a margination, which means it forms a margin around that area that is inflamed. And with this, you'll have leukocytes that migrate to that tissue, and lots of different things are coming to the rescue. The inflammatory mediators come to the rescue. Leukotrienes come to the rescue. So lots of different chemicals and mediators are trying to come to take care of the inflammation and get it cleaned up and corrected as soon as possible, so that the healing stage can begin. So, damaged cells from the inflammation release those mediators, and we have that local response. The inflammatory mediators will cause an increase in the white blood cell production as well, and so we'll see an increase in the leukocytes. You might also see immature neutrophils released into the blood during this time as well. If you look at a lab report and you see that complete blood count with the differential that shows you all the neutrophils, basophils, all those cells, you might sometimes see a cell called BANDS, B-A-N-D-S, and that's your baby neutrophils, your immature neutrophils. So from that local response, we have the vascular stages that occur and the cellular stage that occurs, and it ends up with a local effect being redness, warmth, swelling, pain, and loss of function. Now, on a systemic end, when the whole body is responding, we've got different things, the leukocytes that come to play there and release the interleukins and the tumor necrosing factor. That affects the thermoregulatory center, which leads to a fever. Also, the central nervous system can be affected, which causes lethargy. Even skeletal muscle breakdown can occur as well. And so with the systemic, you end up with a fever, leukocytosis, malaise feeling, and anorexia, and even sepsis can occur. Now, a minute about chronic inflammation, because we've talked mostly about acute inflammation. So a minute about that. It can occur from an acute inflammatory condition or not. It can be just a type of autoimmune thing that just suddenly appears in the body, but is insidious. It's slow in coming, and you don't really even are paying attention to it. And so it might be, something that is just like a low-grade type smoldering response. that doesn't even initiate an acute inflammatory response. Recurrent inflammation processes, when you think about all that happens there, we've got all those cells coming to the rescue and then into the connective tissue, and then we're having the reparative part happen, where we're in the restorative part where we're getting the fibrosis or the scar tissue developed, and so this is a just continuous thing happening in chronic inflammation. And so over time, scar tissue builds up, and just when you think about what we talked about in 210 with coronary artery disease, atherosclerosis, that's what that is scar tissue over time that's developed in the vessels that are feeding the heart. Over time, that can damage the DNA, and it does and can cause a risk for cancer, specifically, cervical cancer is one type, or cancer of the liver because of hepatitis B and C, or stomach cancer because of constant inflammation going on there, or even the gallbladder. So this chronic inflammation can be a precursor for certain types of cancer. Many autoimmune diseases result in chronic inflammation, and two of them that we definitely will be talking about in this unit is the inflammatory bowel disease and rheumatoid arthritis. So I hope that helps you have a better understanding of the inflammatory response, and I hope you have a good day.